Hello, this is Dr. Dumitrescu again, coming to you live from Precision Medicine in Austin, Texas. Well, we recently created a series of blogs and posts about all sorts of new regenerative and functional medicine therapies that are offered in our clinic. Well, those are fancy therapies, but today I want to return to basics and talk a little bit more about back pain, good old back pain, and hopefully talk about the differences between what we here at Precision do about back pain and more traditional therapies. I recently came across an excellent article about the back pain problem in The Economist magazine entitled, "Back Pain is a Massive Problem Which is Badly Treated," quote unquote. Now, this prompted me to think about several key points about back pain, and I want to share these with you. First, the numbers are staggering. 20% of the American population, adults, suffer from chronic pain. This leads to $560 billion each year in medical costs, lost productivity, and disability programs, and this is estimated by the Center for Disease Control. In 2013 alone, according to one study, $88 billion was spent on medical treatments for back and neck pain in the United States. And this was not far short of the $115 billion that was spent on cancer. A great deal of this money seems sadly to do little good. Why is that? Well, a definitive physical cause for back pain, such as a fracture or a tumor or pressure on a nerve or infection or even arthritis, is found in 5 to 15% of people with back pain, according to the study. The rest is all labeled as non-specific, and there is increasing evidence that non-specific back pain is not mechanical in origin. Most of the time, the pain mechanism itself is the problem and not mechanical issues. Traditional back pain treatments consist in medication, back injection, back surgery. As the Economist article points out, and I quote here, spines are injected with cement-like thick mixtures or fitted with various types of medical hardware. Vertebrae are fused together, discs are excised or tampered with in various ways. Yet, unsurprisingly, it is largely the pain mechanism which is the problem, and the benefits of all these offered to most patients are limited or non-existing. End quote. The opioid crisis alone illustrates the crucial need for prescriptions that include more than drugs. Exercise can be prescribed, for instance. Chronic low back pain is one of the most common reasons for which patients are treated with opioids. However, as we all know now, opioid analgesics are not superior to non-opioid treatment strategies for low back pain. Instead, for chronic low back pain, comprehensive care should ideally include exercise, should include physical therapy, behavioral therapy, and in some cases, even complementary or alternative medicine. If traditional treatments fail, what do we do then? We thought about this problem in quite a high level of detail here at Precision, and through trial and error, we came up with our own precision medicine algorithms. This consists in 3 steps, and the steps of the algorithms are diagnosis, treatment, and prevention. So let's talk about each one of these steps briefly. Number 1 is diagnosis. Diagnosis is a process through which non-specific back pain can certainly become specific. This is where we disagree with The Economist. More than 15% of our back pain sufferers are diagnosed. Now, the diagnosis process is painstaking, and it requires not only technical expertise, but also very careful analysis of the results of each diagnostic test or procedure. In other words, it requires time. The second step is treatment. Now, treatment could be for acute crisis, where some spine injections with or without cortisone can be appropriate. It's true that most cortisone spinal interventions are short-lived, but that does not disqualify them from being used in certain situations, such as acute back pain crisis. For chronic back pain, which is a completely different animal, we believe regenerative treatments will be the long-term solution. Now, there are numerous iterations of regenerative cells and regenerative treatments, and we have talked and written about these elsewhere, and we invite you to go to our website and read about them. They too require a high level of technical expertise and evaluation for their success, and they also require a very important other thing, which is lifestyle changes. The third step in the algorithm is, and probably the most important step, is prevention. Our approach to prevention is to make all our patients anti-fragile. Now, this is done with a combination of regenerative medicine, functional medicine, and very importantly, exercise therapy. By now, those of you who follow us have probably received our messages about the ABCs of precision medicine. But to review them briefly, the ABCs are anthropometrics or body measurements, biomarkers or lab value analysis, and cognition or cognitive evaluation. All three of these markers play a role in each one of the steps for our back pain treatment. At this point, I don't want to bore you with talking about things that I talked about before, and you and I have talked about before, but I would like to say a few words about the role of exercise in the prevention of low back pain crises. A study from Brigham and Women's Hospital in Boston, Massachusetts showed that women who walk just 4,400 steps per day, which usually amounts to 44 minutes at a typical brisk walking pace, are at least 41% lower risk of dying prematurely. Exercise, almost any form of exercise, releases feel-good, pain-killing chemicals called endorphins. These endorphins bind to the same brain receptors as the opioids, so they are actual natural opioids, and they alleviate some of the pain without the grave risk of addiction, unless of course you consider runner's high addictive. Exercise therapy can address posture, weaknesses, or repetitive motions that contribute to the musculoskeletal pain, and it can reduce lower back pain, it can improve fibromyalgia symptoms, and it can reduce hip and knee osteoarthritis pain. This is all according to the Centers for Disease Control. For all these reasons and more, federal guidelines say adults should get at least 2.5 hours weekly of moderate aerobic activity, which can be as simple as brisk walking, or at least 75 minutes of vigorous aerobic activity, or some combination of the two. Adults should also perform muscle strengthening activities of at least moderate intensity involving all the major muscle groups at least twice a week. The advice holds for people with chronic health conditions and disabilities if they are at all able to move about and in consultation with a physician. The message is very simple, and the message is this: even if you don't feel like exercising, you should do it anyway, and you'll almost surely feel better for it. Yet, fewer than 20% of adults meet these exercise thresholds. Here are some more staggering numbers. People who meet or exceed the minimum guidelines for aerobic exercise, which again are 2.5 hours of walking a week, have lower healthcare costs by about $2,500 a year on the average compared to sedentary people. This is according to a 2016 study in the Journal of American Heart Association. If 100 million more Americans got on the exercise bandwagon, simple math would suggest that annual savings would be in excess of $250 billion. So, without further ado, I think I'm going to stop here since I tend to talk too much, especially when it comes to exercise. But the take-home points should be, number one, back pain is a massive problem which is badly treated. Number two, the reason traditional back pain therapies usually fail is because the causes of nonspecific back pain usually extend beyond the mere lumbar spine anatomy and into the complicated mechanisms for chronic pain. Number three, at Precision Medicine, we have an algorithm for treatment of back pain with 3 steps: diagnosis, treatment, and prevention. All 3 steps employ the ABCs of precision medicine: anthropometrics, biomarkers, and cognition. Number 4, the most important step is prevention. In our clinic, we use a combination of regenerative medicine, functional medicine, and exercise therapy to prevent further back pain episodes. Well, I hope this little talk was informative and you can take away some nuggets of wisdom about the back pain basics. Until next time, take care and thank you.